All right, so I think one question was asked about mother tinctures, and contrary to what many homeopaths actually feel, mother tinctures is something that I also use in my practice. But you should know which mother tinctures to use, when to use it, how to use it, and I use a lot of them. Like, I store some other tinctures in my clinic as well, so I know which to use, when to use, how to use. But if you use mother tinctures randomly, you will not get results. Like just about 5 minutes back, I saw this case of a man with a lot of cardiac issue, old man. With that, constantly he gets swelling of the leg, and that swelling doesn't go away. He has to take a lot of kind of furosemide and all these kind of allopathic medicine to remove the fluids. So in these type of cases with cardiac involvement, with dropsy, and the heart not pumping enough, BP goes high, I use convallaria mages. This is a little bit like homeopathy classics, for example. And there are so many cardiac mother tinctures that I use. This is just an example. You know, his original remedy actually is aurum mur natronatum. He's an entire case of aurum mur natronatum, this man, who's doing very well. But pathologically, this new symptom developed, I'm treating it with convallaria mages, getting better, stop it, go back to original remedy. So it's a long-term case management, is a very artistic thing. There are many more mother tinctures that I use. And what are the commonest mother tinctures that I use? There are many of them, but different conditions. Like I'll tell you, very often in very difficult renal calculi, with a lot of pain, patient is wrenching with pain, down on the roads, just or on the floor, up and down with colic and with vomiting and nausea, ossimum canum mother tincture, or even ossimum canum 6, beautiful. In very complicated cases of diabetes, very often, and there are many mother tinctures for diabetes, especially Indian drugs like Gymnema sylvestre, Cephlandra indica, Syzygium jumbolinum, Ambroma augusta. But you should know how to use it. Ambroma augusta has a bryonia like state, so there is a lot of joint pains and mouth remains dry. Indian bryonia it's called as. Syzygium typically will have a diabetic foot or almost have no other symptoms other than skin symptoms. Cephlandra will have a lot of burnings. It's a little bit like complementary to sulfur. And Gymnema comes very close to Thuja. So they have a lot of gastric related issues and so on.
So, sir, Dr. Jinal asked why 30 potency was given in this case as mentals and generals and particulars were matching exactly.
Okay, good question. So actually, I'll just tell you. So first of all, you should know in which cases you should give which potency. So Jinal asks that why did I use this potency, whatever I use? Why did I do that? Why did I use 30 potency in that case of very bad COVID case? So what do? I have a very simple formula. Okay. And this is especially for the acute cases. See, there is the potency idea is different in acute and different in chronic. In acutes, generally, I like to start with 30 if the physical symptoms are very strong. And gradually, within 2 days or something, I will go gradually to 200. And if needed, if I see very intense mind symptom and there is no change, I can go to 1M. But if I start with 1M, I can't go to 30 back. So it would be good to start with 30. And I would generally give it 2 times a day, or if needed, 3 times a day. This is what I do now in acute that I do. Also, the other thing I want to tell you, in France and in some countries, only 30 potency is available. The higher potencies is not available in whatever their regulations or whatever. So that was a problem in her case.
So Dr. Bharat asked, in case of COVID pneumonia, do we need to take chest inflammation rubric every time?
Not necessarily, but it would be good to choose a remedy. If the patient has pneumonia, it would be good to choose a remedy which pathologically also forms or has that range of pneumonia. Although it is not compulsory, but 9 times out of 10 it will work better that way. It is just one of the unsaid rules.
So Dr. Seema asked, even though it doesn't cover the totality in autoimmune hepatitis, Can we use chelidonium as complementary remedy along with the constitutional?
See, generally, there is a very interesting concept. Uh, I think it was a French author, Bournonville. Okay, 40 or Bournonville. I used to read his books in my college days. Very beautiful booklets. If you can get hold of it, read it. Very beautiful. So he spoke about something called as satellite remedies. What is satellite remedy? Very interesting concept he gave. He said that there could be one remedy for the patient, individual remedy, whatever, constitutional remedy. And along with that, the patient state may require a pathological remedy, where after the indicated remedy, there may be a pathological remedy required. For example, the individual remedy is lycopodium. After that, the pathological remedy may be, I'm just saying maybe, for a liver related issue, maybe cardos is required. Maybe. If liver symptoms come up. If something else come up, some other small remedy come up. So generally, satellite remedies are a little smaller remedy, which are more organ specific. Chelidonium is not a smaller remedy. It's a full-fledged polycrest remedy which has been proved by many, many classical homeopaths. So, also Burnett also spoke about this kind of approach. It's good to know all these things, you know. In very, very complicated cases, I also use this approach at times. It has good kind of results as well. But that's what it is. You have to learn different approaches.
I think so we can take a last question by Dr. Chaitra. She asked that to take a dream in totality of symptoms, it must be repeated if we are dealing with a chronic case.
Yes, it should be repetitive, it should be intense, and it should be central to the case. All this should be there.
So, Namaste from Mumbai. I am Dr. Gaurang, based in Mumbai. So, we have just recently started the course on classical homeopathy. This is a 7-month course. It's a weekend online course, one of its kind, with close to about 20 global homeopaths teaching so much in depth about organon, materia medica, repertory, that I would want to invite every single homeopath there for this course. You can join anytime. It would be 120 hours. It would be only weekends. And the recordings would be available for 1 year. So you will get to see the videos again and again close to 1 year. So that would be a major advantage for any homeopathic student who is either studying homeopathy in college or an intern or a practitioner. There is something for everyone. Once you join the course, you also become part of one of the WhatsApp groups, one of the top WhatsApp homeopathic groups, or a top group that we have curated, where we'll be putting up a case every week and you will be solving cases. So this solving cases helps a lot. Now almost close to 50 cases we have put gradually. We are going to be putting, and you can solve it. That's a very special thing that you could do. Not just about organon, materia medica, and repertory. We'll also talk so much about different approaches. You're treating cases of acutes. How we can treat cases of currently acute COVID. How we are using remedies like streptococcinum, pyrogenium, influenzinum in today's acutes. How we are using the remedy China, for example. Today I saw a case, chills begin from back. One of the top remedies, Eupatorium perfoliatum. So these kind of very important kind of clinical indication. We will also talk about other approaches, how to treat hormonal cases. Here in my clinic in Mumbai, you can see this is my clinic. We are treating many PCOD cases, thyroid cases, endometriosis cases. What is the approach? How I use sarcodes, how I use nosodes, how to use organ specific remedies, how to use backflower remedies, how to use star of betel, how to use biochemics in today's time with cough and cold, little dullness, malaise, whitish discoloration of discharge, tongue white, calimuriaticum 6x, how we are using it. So there are so many different approaches we are going to be talking, and that is why with open arms, I want to invite every single one of you. You can join, be a part of us. There are close to 650 doctors who have already joined, and we have a limit of 900 seats for now. So you can write to us, write to me. There will be an entire email ID with all the details of the course below. You can write gaurang@gmail.com, and it would be so good to study with you. Namaste.